A very important section of the report summarizes what we know about bullying prevention. And while we acknowledge the critical influence of factors at the community and family level, the vast majority of rigorous research in this area has been conducted on school-based prevention programming. We adopted the National Academies Public Health Framework and organizing our review of the literature in this area, whereby we focused on universal programs, and these are strategies that might be implemented for an entire population, like a social emotional learning curriculum for a classroom or a school climate promoting program for an entire school environment. We also reviewed the available literature on selective programs, and these are targeted at individual youth that may be more vulnerable for bullying involvement. And this could be pull-out programs for youth that are identified, such as some of the subgroups that Sandra talked about, or youth that have certain risk factors that might make them particularly vulnerable. And then indicated programs. These are the slightly more intensive programs for youth that are already involved in bullying, either as a perpetrator or as a target, and are experiencing some of the mental health consequences or academic consequences. These could involve more specialized training for counselors or mental health providers, either within the school or within the community. With regard to some of the programs within the school setting, the vast majority of rigorous research, and these are randomized studies that allow us to draw stronger conclusions regarding causal impact of these programs on student outcomes. Most of those programs have been developed and implemented universally, so used school-wide or classroom-wide. Yet many of these programs produce relatively modest impacts. Some of the stronger effects of these programs have been observed in countries outside the U.S., and perhaps when they're transported to the United States, they may not have as strong of a cultural fit and contextual fit with U.S. schools. Nevertheless, there are some promising programs that are summarized within the report that address issues at the school-wide level, but most of those are multi-component. And by this I mean they would include perhaps a classroom-based support system, training for the teachers about how to detect bullying and intervene, be it in the classroom or in other hotspots like on the playground. Parent components as well are also a critical element of a successful bullying prevention effort. And more broadly, we can look at the literature around the importance of relationships, how we can help youth feel more connected to others within the school environment, and that includes connection to peers to feel supported and develop empathy and relationships that can help buffer the effects of bullying when it occurs and actually try to prevent it through effective bystander behavior, as well as the importance of relationships with parents and adults, so that way we can have more open communication about concerns related to bullying, and kids can feel more comfortable disclosing incidents of bullying to adults for them to support and intervene. With regard to areas needing further research, we certainly need to focus more on programs for kids that are more intensive, those targeted and indicated programs. What do we do when a kid's already involved in bullying? Well, right now we're turning largely to programs that are used in the area of violence prevention because there have not been very many programs focused specifically on the needs of bullied youth. And while some of those programs do appear to be promising at producing positive impacts around mental health, we need to be thinking a little bit more about some of the sensitive issues that are specific to bullying as we develop these programs. Another area needing more research is about the impact of these programs on subgroups. Many of the subgroups that Sandra talked about could be part of these studies, but there are often too few of them for us to be able to draw a conclusion about the impact of Program X for LGBT youth or youth with autism. So we need programs not only that are developmentally and contextually appropriate for these subgroups, but also to understand if there's some subgroups that are more responsive to some interventions than others. We also reviewed the literature on zero tolerance policies, and the committee concluded based on the literature reviewed that these models are generally not effective for reducing violence within the school community, and that there's no evidence that they are impactful in a positive way for bullying. In fact, the literature suggests that they may actually increase disparities between youth, specifically as it relates to minority youth getting more office referrals and suspensions and longer suspensions, so they can actually do more harm than good. and in fact don't provide the skilled training or replacement behaviors for youth that are suspended or expelled. So they're generally not a recommended strategy in school-based prevention, and not one that we are advocating for as it relates to bullying prevention more specifically. We need more research in the area of peer-led programs. Peers have a tremendous impact over child development and success in the school environment, and we're not quite clear where to engage them around bullying prevention programs. In fact, there's some difference of patterns of findings as it relates to the role that youth can play. Some studies finding that peers can actually increase deviant behavior among their peer group if it's not well managed. But there's a lot of energy and youth voice that could be leveraged in a positive way. So we need more research to understand the important role that peers could play and better study designs to address that. And finally, while we don't have a long list of bullying prevention programs, there is a much larger body of literature around social emotional learning, youth violence prevention, and positive behavior support. Many of these models have been shown to be effective at also reducing bullying in addition to other problem outcomes for youth. So we think that those models could be leveraged, but do need to be studied further to determine their impact on bullying more specifically. So as it relates to recommendations, we believe that there need to be new programs developed, an additional focus on implementation supports, because just because the school is implementing a program doesn't necessarily mean that they're doing it well or that it's achieving the intended outcomes. And additional evaluation. There are some emerging models that are promising that we need to attend more to in our research. And finally, we'll talk just briefly about the role of policies. There's a separate chapter within the report that summarizes what we know about the 50 different states that have policies specifically related to bullying, in addition to the District of Columbia. Nearly all of those address issues of cyberbullying and have a significant impact on local implementation of professional development for staff and policies and programs for individual schools. Yet we need more research to understand what impact these policies are having as it relates to trends in the rates of bullying overall. And finally, a recommendation related to policy is that we need more data sharing and sharing of best practices in this area, where we can conduct more comprehensive reviews of the policies and make recommendations to state legislators as well as to the federal government regarding potential impact of these policies and best strategies for consistent implementation.